learned the hard way. Nothing's overnight. Some days you lose, some days you survive. Still strong, even moving slow. Every step counts more than you know. I found gold in the everyday, and showing up and staying brave. Still strong, yeah.
Today's conversation is going to be about hormones, peptides, toxins, nutrition, and longevity. Dr. Tareq Khader, welcome to the Still Strong podcast.
Thank you. Happy to be here. Thanks for having me. Such a pleasure.
I'm looking forward to this one, brother.
Yeah, same here.
We've been trying to get together like 2 or 3 times, and we finally made it happen.
Yeah. 2 months, been 2 months, I think. 3 months.
Yeah, I think so.
Yeah. Life happens, man. Life happens.
Yeah, no, it's good. I'm glad to have you here. It's an honor.
Yeah.
Before we get rocking and rolling, for people who don't know you, who are you today, and what's this current chapter of life like for you?
So I am a physician by training. I currently own Naples Longevity Clinic in Bonita Springs, which is a health and wellness and longevity clinic. I take care of a lot of issues, but mainly I try to keep people healthy, well, live longer, and live better. How did I get here was quite a bit of story, actually. So training in med school and residency and all that, you're given a textbook, you're given some cases, you're getting some sick patients, go to the hospital, see them, go to the clinic, see them. Here's the diagnosis, here's the treatment. Nobody really touched base on, hey, well, how do we prevent this from happening? How did this person end up here? What could have we done 20, 30 years ago before this has happened, where this person would have been well and happy with his family or her family? Really didn't ring a bell at all up until we got to COVID. COVID happens, a lot of issues happened. I was at the hospital in the middle of it. All the hazmat suits and all the stuff that you saw on TV, we did that, lived it, nightmare. So I see a lot of sad stories, a lot of people dying alone in the ICU, all these, isolation metrics, which I understand obviously, but how do we get here? From there, I started noticing, why do I have 2 quote unquote healthy people or very symmetrical patients? One of them died and one of them barely made it to the hospital. They were fine and they got the same disease. Just kick it. And that started a very big thought in my head, and a light bulb came up. There is something more than healthy means being on a drug, or healthy means you take a medicine, or healthy mean you don't have a disease. And eventually came down to the conclusion, health is not the absence of disease. That is not what health is, right? But doctors are taught that. Healthy means that you're not on any medications, your blood pressure is good, your cholesterol is good, you're good to go. See you next year. That's what health means, or healthy means. How many times have you heard of quote unquote healthy people drop dead? Right? They did not just suddenly become unhealthy. They've been unhealthy for 20 years. It just showed up right now. So, that took me down the rabbit hole of cellular medicine, mitochondria, DNA, epigenetics. What is beneath the surface? Why is blood work not showing what we're looking for? Why are people really sicker than what they look like? Why do people react differently to certain diseases? Why people in COVID era drop dead? Why other people just survived with no problems? Why did people have long-term effects? And don't get me wrong, with COVID, there's still a lot we don't know. There's a lot we're discovering as we go, but the whole idea and the whole concept of health and what does health mean started over there. So that led me to where I am today. There's the clinic I run right now is it started off as a hormonal clinic, which came across for sale because the doctor was retiring. He was, getting closer to his 80s. So, it was a great opportunity. So I took it on, but applied everything I learned and, learned more, and, got into the field of longevity, which really longevity is nothing more than one-on-one listening to the story and focusing on preventive care, because longevity is very, very, very simple. Longevity is not stem cells. Longevity is not PRP. Longevity is not all these, fancy drugs out there. Longevity is very simple. 95% of longevity can be achieved through very simple measures. So, that led me to the idea of doctors are underrated. They are overworked. They're underpaid by insurance. Insurance dictates the game. So I started helping other doctors do this. So on top of the clinic, I have a consultation company where I consult on doctors and providers to transition from what they do to what I do all across the country. The company is called Longevity Blueprints, and been successful transitioning a lot of doctors, and that is a very rewarding in other ways, but because you spread the knowledge, right? At the end of the day, you want to spread the knowledge, and you cannot just sit in lectures and lecture at people, because that's actually the least effective way of spreading knowledge. I think the best way of spreading knowledge is that way, is you teach somebody, that somebody's gonna go teach somebody else, etc. So it's been it's been a great chapter. I'm gonna be 40 exactly in a month, and I think I did not see myself being here when I was 30. So when I was 30, I did not think at 40 I'm going to be where I am today. Very happy, very content with it. Obviously always looking for growth, and spreading the word and helping more people. And there's nothing more rewarding than really helping people achieve their health goal, and you really see the transformation. You see somebody come in struggling and having a lot of questions. They don't know
where to start.
Yeah, and then they, a year later, you look at them. They're there. We have actually a lot of people. They quit our program just because they got where they want to be.
Nice.
Like, okay, there's nothing I can tell you.
Nice.
Yeah.
I want to set the stage with how you and I met, and what we'll do is we'll go from when you and I met with that phone call and where I am now. Just use me as an example of a blueprint of what you do. But before we get going, everyone that comes on the podcast gets a gift.
Yeah.
I was on your podcast and I gave you a gift on yours.
Yeah.
Well, this is a different design.
Yes.
So I got to keep you up to date. These are Richardson 112s. My kids tell me they're the best.
Thank you.
You have the originals design. That's version 2.
I do. Amazing. Thank you so much.
You're welcome.
All right. Great.
So I'm going to set the stage, brother.
Let's do it.
I was getting ready to turn 50. My parents had me when they were 17 years old. So in all reality, they're not much older than me. So I just kind of been measuring my health off of them just because they're a little further down the road. And there seemed to be this reoccurring theme that you get a new ache or pain and it's just your new normal. Hey, Mom, why don't you go get that checked out? Oh, I'm too busy. I got to take care of the chickens, or I got to take care of the grandkids. They put off their health. I'm too busy. And with me having 7 kids, and now I'm having grandkids already, like the potential for me to have a bunch of grandkids, I want to make sure that I'm fit, that I'm healthy, that I'm there when they need me. Like, it's very important to me. Plus, just in regard to my fitness level, I just feel better. Like when I'm working out, it detoxes my stress. It cleans my brain. So I wanted to, in preparation to be 50, and knowing that the closer you get to the core of that toilet paper, the faster it goes, I didn't want to get caught in that cycle where felt like, oh, I'll do it later. I wanted to do it now. I did a Google search. And I'm thankful for Google. I'm thankful for technology. But when you don't really know what you're looking for, you can get lost in the weeds. And I got lost in the weeds quick. So I used my ChatGPT. I set parameters. Here's where I'm at. Here's where I want to be. Set me up with the 3 best ones. And you were one of the 3. Actually, you were the 3rd one that I called. The first one, never called me back. The second one, an appointment was 3 months out. I called your office and your nurse in-house said, well, the doctor's here now. And do you remember that conversation?
Yeah.
I thought that because I was fatigued, I was tired. I thought my testosterone was low. And I told you, I said, listen, I don't want to take TRT because I'm afraid that if you take TRT, your body will stop making
True.
it. I want to do things the natural way first. And you and I were vibing. You were that holistic. Hey, well, let's do this holistic stuff first. Give your body what it needs to jumpstart it. And if it doesn't work, there's other options. So I'll set the stage there. You take the ball and run with it.
Yeah. That's where it started. A lot in the background. We prepared for your visit. You came in, we did the blood work. Based on your symptoms, I was expecting something, but my eyes were open for other things. Your testosterone came back higher than, a 35-year-old. And definitely your symptoms were not from
Listen, brother,
testosterone.
tell them what my numbers were.
They
Hype me
were-
up here.
They were in the thousands.
In the thousands, bro.
Yeah.
In the freaking thousands.
Yeah, they were in the thousands. So, what you have just described about working out and living a healthy lifestyle, being outdoors and all that stuff contributed to that. You probably have some genetic also superiority there, but at the end of the day, you take care of yourself. Everybody who has that mindset where I want to take care of myself before it's too late, I want to do this before it's too late, really has the right question in mind. Because you're not 80 years old, you're not 70 years old. Because we have a lot of people that come at that age, and it is a little too late. We still work with them, but it's a little too late. So, the age you came in is great. I have people coming in earlier, which I prefer. But the good news is, even though that you were not at that lower age in the late 30s, early 40s, your body is acting at that age, right? So you listed your symptoms. You were talking about the fatigue, the tiredness, and you were ready to go on some sort of testosterone treatment, whether it's holistic, whether it's supplements, whether it's nutrition, etc. I think we talked back then about ashwagandha and magnesium and how can we push it. To our surprise, it was like, oh, this is great. That's not what we're doing, Then we started looking at other things, other venues, your growth hormone. We started looking at thyroid, at the DHEA, at the pregnenolone, other things. And we came up with this formula, right? And, we slowly built up to it, if you remember. We started with just a couple of supplements. I think your vitamin D was very low.
That's what it was.
And
Which surprised me because I'm out in the sun, no shoes, no shirt.
Yeah.
And it just surprised me.
Yeah.
But the type of vitamin D I was deficient in, I think you said, was from nutrition.
The nutrition. Yeah. Because we are, again, going back to education and teaching, you think that you just, oh, I'm going to spend some time in the sun. Well, no, your color makes a difference. Your skin makes a difference. The time of the day you go out makes a difference, right? And your genetics make a big difference. Some of your vitamin D comes from food. Some of it comes from sun. Our food is void. Our soils are empty. There's no more nutrition right now. So our foods do not have as much vitamin D as did before. I am yet to have a person who has, I'm not going to say normal vitamin D, right? That's another challenge we'll talk about in a little bit. Yet to have somebody who has a vitamin D level that is optimal, that is not in supplements. That was not the case 100 years ago, right? So we put you on vitamin D, as simple as that, right? And we didn't jump you into peptides from day one. We didn't, do all these fancy measures from day one. We hit you with a VO2 max, I think, from that first week or 2 weeks into it, and that was also pretty impressive.
Just say it. I crushed it. Just say
you
it.
crushed it. You crushed it.
You can't have a podcast called Still Strong
Yeah.
and come in with some weak numbers, man.
Yeah. No. Great numbers, great metabolism, great VO2 max. And the vitamin D made a difference. Now, going back to that lab situation, why is it a challenge for me to say normal? Who sets normal, right? A bunch of people who looked at about 100,000 samples, and they took an average. And again, healthy people, right? Quote unquote. People between 40 and 50, they're quote unquote healthy. They're not on drugs. Their testosterone averaged between 300 and 1200. Hence, that is our average. That's what we're going to put in. Well, great. That's for statistics. Yeah. If you want to go into statistics and say, statistically, you're going to fall between this number and that number, right? But everybody's a little different. Everybody reacts differently. Somebody might have very low testosterone symptoms at 500, right? But yet if you look at the lab, if you look at the insurance payments, if you look at when insurance is going to pay for it, it's not going to pay for it until you test it twice, and both of them you are less than 250. So, what if you have the symptoms of low testosterone? What if you have all the classic symptoms? You're weak, you're fatigued, you're depressed, you cannot work out, you're losing your muscle, and your testosterone is 400. Sorry, you don't qualify, right? So, this is when we let a lot of non-clinicians, bureaucrats dictate healthcare, and this is not how it should be. It should be a clinical judgment, a clinical workflow. You look at the labs, you talk to the person. Now, I'm not saying that the alternative is picking up the phone or the Zoom and talking to some sort of service and looking at your numbers and talking to you for 3 minutes and prescribing you testosterone. That's not the alternative, right? I think everybody should be looked at differently. There's a concept in longevity called N equals 1. N equals 1 means every patient is their own statistic. Okay, so example. This study showed that when we looked at 300,000 people who had the following criteria, and we excluded these criteria and we put them through this filter, if we gave them intervention A, this happened. Okay, so this is a randomized controlled trial, and this is the standard of care of evidence in medicine. But that's not the reality, right? I love this concept when you are dealing with a population level. When you're able to apply the concept of N equals 1, me and you sit down one-on-one, 1 hour, 2 hours, 3 hours, over and over, talk about nutrition, talk about exercise, meet you, know about your social life, know about your stress, know about your story, know your history. This is where, wait a second, despite Keith being on that list of patients who had checked the boxes 1, 2, 3, 4, if I do intervention A, then according to statistics, he must have that outcome. But no, from my knowledge of Keith, from me understanding what he's going through, I think that we have to do intervention B, not intervention A. I made that decision based on two things. Because I'm a physician, and being a doctor is an art. It's not just something you memorize. And number two, I spend enough time with you. So I think these two things, we have a lot of doctors, but we don't have a lot of time. So from there, we took you on, we brought you, we did the blood work, we put you through the torture machine on the bicycle. We placed that big mask on your face. That is the VO2 max. That is, I'm going to tell you one little fact there, and I actually educate doctors about it, and everybody's just opening their mouth. When you hear about cardiovascular disease, right? What are the risk factors? Just out of your mind, like when I tell you risk factors for cardiovascular disease, what comes to mind?
I don't know.
Cholesterol is the first thing that people talk about, right?
Oh yeah, everybody's cholesterol's high.
Cholesterol,
They told me my freaking cholesterol's high.
hypertension, smoking, genetic history, diabetes, right? There's a few of them. You look at them. So when you want to look at somebody's score, according to current guidelines 2026, you look at all these things and you determine a score. And based on that score, you determine your next step. Should I do an imaging? Should I put him on a statin? Should I do this and that? But there is one thing that is determined to be one of the highest indicators of mortality, which is fitness level. Your fitness level determines your mortality risk from cardiovascular disease more than anything else I just mentioned. But it's not in any guideline.
Oh.
It's not in any guideline whatsoever. How do you measure fitness level? Freaking VO2 max. I know it's a torture machine, but it's 30 minutes of exercise. That's what it is.
Yeah.
30 minutes of sweating and being in a doctor's office.
Yeah.
You'll get so much information. You get so much risk stratification, better than any other test. Better than cholesterol. But I mean, yes, of course, if your cholesterol through the roof, if you're if your blood pressure is high, if you're diabetic, I'm not ignoring that. But there is so much stuff in your lifestyle that are not looked at, and we measured that for you. We looked at it, and you sat down with Justin.
Yeah. Nutritionist.
The nutritionist back then. I didn't have Libby back then. Right now we have her. And he talked to you about exercise, and I believe he gave you some exercise tips and tricks. You did the body composition. We knew how much visceral fat you have, how much muscle you have. also score through the roof. You know, so people know. And we gave you a comprehensive plan, and I think this whole process took us a month and a half.
Yeah.
Right, between back and forth, phone calls, this worked out, this didn't work out, let's do this, let's do the supplement. And after that, we jumped into peptides. After we got you to a point where, okay, I'm feeling better. I know where I am right now. Now I just want to improve and I want to excel.
And even the peptides, you didn't hit me with a bunch of them.
Yeah.
It was systematic. Do you remember the first one you put me on?
Either Sermorelin or CJC, I think one of these two.
It was an oral one. It was MNRA or something like that. It
Oh,
was an
1-MNA. 1-MNA is not what is not a peptide. 1-MNA is it's not a precursor. It is a way to trick your body that there is not enough NAD, so it stops breaking down NAD. So your NAD levels could climb up.
That was the first thing you put me
Mm-hmm.
on. And then you put me on, and you can talk about that, what it does in depth if you want to. And then you put me on something that I heard on Joe Rogan, but I never knew what it was, methylene blue.
Mm-hmm.
What does that do? What are those two things you put me on?
So methylene blue, let's talk about 1-MNA first.
Yeah.
1-MNA is an actual supplement. So everybody has it. So we have it all in our body. What it does, it tricks one of your enzymes that breaks down NAD. And NAD is that compound that is crucial for majority of enzymatic functions in the body. If we have no NAD, we all die. But now there's a huge thing out there, NAD infusions, NAD infusions, NAD infusions. They're nothing but money schemes.
Okay.
So you go there to an ID clinic, they give you an AD, it costs you $400, it costs them maybe $30, and you're out of there feeling great. The reason you're feeling great is because there's a transient elevation and certain markers on your body as a reaction to the infusion, not the infusion itself. That's going to go away in a few hours. And that physiologically, that doesn't work. The NAD molecule is so big, it is almost impossible for it to cross from the blood into the cell. It's just so huge, it's not going to cross the cell barrier. So we still need to work on your NAD. How do we do that? So again, you think about the art. So let's think backwards. So we trick your body to think that you don't have a lot of NAD. So let's stop breaking it down, because that is a cycle. And if you look at NAD as a bucket, so you fill that bucket with water, and as you get older, there is a small hole in the bucket that keeps getting bigger and bigger and bigger. As you get older, you're going to lose more and more NAD. NAD infusions, NAD precursors, all of that stuff, you're just pouring water into the bucket. What we do with this trick is we plug the hole. You plug the hole and you let the body handle it. So you keep the body equilibrium. You don't give it too much, and you let the body do its thing. You just allow the body to do its thing with no pressure. Also, people don't understand that inflammation, prediabetes, insulin resistance, stress would tank your NAD levels as well. So there's so many factors why NAD could be low. Nobody looks at it. They just want to give you the infusion, just charge you $400 for it, But that's the reality of today, because I think what I started with, the traditional medicine, which I think still has a huge role today. I think I still take call at the hospital, and I know how important it is, and I know, we need to understand a lot of these things. But the frustration from traditional healthcare system created that paradox, created that other end where, a Quack Jones at the end of the street here, he goes on a podcast and he just talks about whatever he wants just because he looks nice and he has some followers. You go look at his background, the person never attended school, medical school, pharmacy school, nursing, none of that. They just read online some stuff and they're just teaching people some medicine, and then people follow that. So but it comes from frustration. It comes from people being frustrated about healthcare system, about how things are going.
Let's save this for a segment in its own, because I know you want to talk about that.
Yeah.
So I want to kind of like turn pages in a book.
Okay.
Right now, I want to talk about what you did for me through the whole process.
Yeah.
And then I want to jump to another chapter, and we can jump to that chapter next, because I know that's a hot topic for you.
Yeah. So the other supplements or the other addition we added for you was the methylene blue.
Yeah. What does that do?
So methylene blue,
Other than turn your pee blue.
Well,
And
methylene.
listen, the nice thing about that is I rarely forget to flush, but sometimes when I do, my wife don't get mad anymore. 'Cause she thinks it's the toilet bowl blue
Oh
stuff.
yeah. So, yeah,
It'll
so
turn your
you
pee
get some,
blue.
and it lasts for a couple of days. If you miss it a day or two, it's still there.
It's
So
still there.
methylene blue is a medicine. It's been around for a very long time. It used to be the gold standard for treatment for malaria. Some anesthesiologists still use it to battle certain toxicities. So it's still around. You can get it as prescriptions. It is for certain overdoses, etc. We use very small dose compared to the traditional dose. It is a mitochondrial support medicine. So the mitochondria, just in a nutshell, is a very small powerhouse that sits inside your cell, and it generates the energy, the ATP. That's the main function of it. But there's billions of functions that happen, but generating energy is the biggest thing and the most thing that we know about right now. So what methylene blue does is it optimizes that process. If there's some mitochondrial damage, mitochondrial injury, um, methylene blue helps that, and it helps the mitochondria utilize oxygen better. So what we call the cellular respiration. So they're literally breathing. So the cell breathing gets better. Symptomatically, a lot of people with brain fog, a lot of people who have issues concentrating, a lot of people who had some depression, anxiety, generalized anxiety disorder, etc., they do benefit a lot from methylene blue for the same reason. But we're talking about brain cells.
Because it's oxygenating.
It's helping the cell utilize oxygen better.
Okay. Which would make sense that you would have less brain fog.
Correct.
Okay, that makes sense. Okay.
Correct. So that is what it does in a nutshell. I usually use it on cycles. We sometimes use it for a short period of time. We stop it. Sometimes we do cycling. Sometimes people benefit from it so much that we keep them on it. So there's no current protocol for it, but that was what it is. And I think the third thing we put you on is a growth hormone secretagogue, which was the injection. Samoralin. And what that does is it tells your body to produce more growth hormone. It is not a growth hormone. It is a growth hormone secretagogue, a stimulator for growth hormone production. It does very similar things to the muscle as what the testosterone does. Improves muscle endurance, improves muscle strength, well-being. Some people benefit for sleep. But again, it's the last thing we added, right? So we build up to that because you cannot start it if you, for example, have terrible sleep. If you have very poor sleep and you give yourself a peptide, that's just not going to work, right? So peptides are great, and they're great additions, but they're modulators. They are not going to work if you don't provide the environment for them to work. So that's why I usually choose to start peptides towards the end. And then from there, it's cruise control. It's, obviously if you have something wrong going on or we need to reassess, blood work twice a year. Things happen. Testosterone could drop. Other vitamins can show up as they're deficient. We could see some inflammation popping up. We could see some changes in your heart numbers. Forgot to say something about what we did for you too. We did the heart scan.
Before we talk about the heart scan and the lung scan, I want to go back to Samoralin because I felt that, brother. I felt that. So I remember my pull-ups were becoming weak. So if you do say 5 sets of 5 pull-ups, I noticed that I would have to rest longer to get that 5 by 5. Okay. So where before the first set I could do 5, maybe I rest 30 seconds or a minute. I'm back on. I can do my 5, rest 30 seconds, a minute. I'm back on my 5. I noticed that it was taking me longer rest to hit that 5. So my first set would be 5. My second would be 5. My third set's 4. My fourth set's like 3. The last one's like 2. That first week I was on that freaking Samoralin, the best way I can describe it was, you guys that are in construction, my boys like Milwaukee, when you have a brand new battery, that sucker holds a charge and charges faster than the one that you've been using for 2 or 3 years. The one that you've been using for 2 or 3 years, it doesn't get up to a full charge and it doesn't last longer. I felt like my battery charged 100% and I felt as I was doing my pull-ups, it was ramping back up. I felt strong, man. The methylene blue, I didn't feel too much. The other thing that you didn't talk about, but that Samorlin, I felt like I was like the Hulk, man. I told my wife, I was like, girl, I thought I was strong then. I was excited about it.
Yeah.
So I felt that one. Yeah. The only thing I didn't like about it was the injection.
It's a shot.
I know. I don't like
Yeah.
it. I'm used to it now, but I didn't like it.
Yeah. Yeah. We know you're a little scared of needles.
Yeah. You can tell people that. Yeah. So the Samorlin I felt.
Yeah. Yeah.
And then you did the scans. I went to heart scan. I think
did the
2
heart
heart scans and a lung scan. Yeah.
Go back a little bit when you said that people said you have high cholesterol and you need medicine, right?
Yeah, they did.
So we do a heart scan because some people, and we have all these classic examples with absolutely pristine looking cholesterol numbers. You do the heart scan and they almost have a 90% blockage. Well, why? Because the problem is not the cholesterol. And then you have somebody like yourself with really good cholesterol, and you do the heart scan, and the heart scan looks, your cholesterol was quote unquote not good, right? For other doctors. And I remember when I told you, it's like, listen, I cannot make a judgment just by looking at these numbers. I need to see visual. I need to see what did this do to your arteries, because statins are not side effect free. And I'm not a conspiracy theorist who would say statins are the worst thing in the world, or it is overprescribed, no question. But there is a place and a time for them, and you're not in that place or time. And the only way we knew this is by looking at your heart and your blood vessels. And it's not something we're going to sit on forever. We're going to do the scan every 2 to 3 years and see if you develop anything. The likelihood that you're 50 years old, so when the statistics say at 60 years old, if we do that scan and you come back with a clean, pristine scan like yours, the likelihood of you developing cardiovascular disease, if you do not change anything in the next 10 years, is virtually zero. I'm talking about cardiovascular disease from plaque, like heart attacks or any of that. We're not talking about arrhythmias or AFib or structural disease or any of that. So that was the purpose of the test, is just to have a visual. It's like, you've been labeled high cholesterol for maybe 20 years.
Yeah.
If for that...
You know what they told me?
Yeah.
You need to work out more.
Yeah.
I said, come on over and let's do it.
Yeah.
Come on over and let's do it and tell me where I'm slacking.
Yeah.
Work out more was this. And then they want to prescribe me with that, whatever it was, that cholesterol medication that you see on TV all the time. What's it called? Lipitor or something like that.
Yeah. Yeah. So that scan is very enlightening, because if you, let's say the other way, let's say that your scan came back with, 20% or 10% or 15% blockage, right? I'm going to tell you, listen, Keith, right now it's not a problem. But 15 years from today, I promise you it's going to be a problem, But let's look at likelihoods. Again, n equals 1. You've been labeled like that for 20 years. For 20 years, nothing happens. What is the likelihood that this is the problem? If there is a problem to start with, So if we're gonna go that route, your likelihood is very low. The reason is, back to the mitochondria and methylene blue, statins are mitochondrial toxins. They directly affect mitochondria. There is a good correlation between statin use and diabetes and metabolic syndrome. People get muscle aches and pains. A lot of people just don't feel well with them. They're all athletic. I see them all the time. They come in and they have lesions on their heart scans, and I put them on statins. A lot of them are cyclists, and a lot of the response is, "Doc, I cannot cycle anymore. My endurance is down." So obviously we stop it and we look for replacement. So put a bookmark on that one, because I'm going to mention that in the traditional healthcare system section. So, and then we did your lung scan. We're looking for cancers, for lung cancers, and we gave you as close as it gets to a clean bill of health. I didn't say 100%, right? But we did, over a course of 2 months or 3 months, maybe more than what you did over 20 years.
Yeah, and I just want to say that I didn't run any of that through my insurance. I self-paid it.
Yeah.
And those scans really weren't that expensive. They're reasonable.
Yeah.
So just that to have a little bit of peace of mind
Yeah.
for something that's not that expensive. It just
Mm-hmm.
felt like the right thing to do.
Absolutely. I
Yeah.
agree with you 100% because a heart attack is very expensive,
Hmm.
regardless of the health outcome. You know, that trip, the ambulance trip alone is more expensive than the heart scan.
Yeah.
You know, so preventive care is like an investment. You put the money up front.
Yeah.
You know, it's health insurance is like a very bad investment. You have to do it though, you know, because you never know that day when you have a car accident or your appendix ruptures or something that you're gonna need surgery. But the way the structure it's made, it's just when I get the hesitation about paying the money, I understand it obviously, but I think if you look at it as an investment into your health, I think it'll make a lot of sense.
I want to move to another chapter. Are you
Mm-hmm.
ready?
Yeah.
I think you hit that one pretty well. Is there a move from traditional mainstream medicine that's driven by insurance companies to this type of style that you're doing? And is it affordable for most people?
Yes and no. So now this is where my longevity blueprint company really comes in, you know, handy to a lot of doctors. Is it affordable to most people? The answer is unfortunately not.
Hmm.
Regardless how you phrase it. Your heart scan was how much? 360 maybe, $370. You know, I think if I'm not wrong, 80% of Americans they don't have that extra cash that month,
Hmm.
right? Um, but can you do n equals one for everybody? Yes, you can.
Okay.
But here's where the trick is. As a traditional doctor, a regular primary care doctor, the way it works, you come in, you present your insurance card. A lot of the staff up front takes your insurance, you fill out a paper, you come see me for 10, 15 minutes, I bill the insurance pays me. The insurance pays me pennies. I'm going to say pennies, very little. Okay. It's actually a little insulting, you know, with the numbers. I'm not going to say them because it's really bad.
Okay.
So the doctor has to make a living that is decent. The doctor has to see about 30 patients a day. Call it a 10-hour working day.
Hmm.
No lunch, no breaks, back to back. What kind of day is that on the doctor, on their mind?
Hmm.
What kind of care did they provide? What
Hmm.
kind of outcomes are they looking at? So they're driven all by protocols. What it is EMRs or electronic medical records or systems right now, EHRs. You log in to these brand new ones and the one that are driven by insurance, and you say, you know, this patient has Medicare or whatever. It has a checkbox. From a machine. Ask them about the colonoscopy, ask them about the heart, ask them about this, ask them about family history, documents. If you don't document all that, you're not going to get paid, right?
Hmm.
So you have to go, you spend more time documenting
Wow.
than you're actually talking to the patient. So this is the health insurance world. So for the doctor to make a decent living, they have to see this many patients on daily basis, take no more than 3-4 weeks of vacation a year. And at some point, the life expectancy of doctors was 59 years. You know, this is the reason. So the cash pay out of that is we reduce that number from 10,000 patients to 200 patients. But you got to get paid, right? So this is where the cash pay comes in. And, you know, you pay a fee, you pay a membership fee that covers that cost, but it also gives you as a patient a peace of mind that this doctor is my quarterback. I can call him regardless what's going on, what time of the day,
Yeah.
and he can give me an advice, and I can call him and pick up the phone and say, hey, listen, this is what I ran to. This is what I want to do. What do you think?
Yeah.
That luxury is not, it's not just because the other doctors don't want to give it. It's just because they don't have time for it. So that is why if you want to, you know, call the number 300,000, right? If a doctor wants to make $300,000 a year, roughly. And if you want to translate that into, you know, the current model of the cash pay, you know, they don't have to see more than 100, 200 patients, right? Depending on what kind of price they set up, what kind of overhead they have, and all that stuff. So this is why it's very challenging for doctors on insurance plans, and that's why you're seeing a lot of shifts. A lot of the stuff I hear from patients. They come in, my doctor switched to concierge, my doctor switched to concierge, my doctor switched to concierge. And, or you hear something, do you know any primary care doctor? My doctor switched to concierge. And right now you have big companies actually purchasing these concierge practices. Now you have Naples Community Hospital has a concierge practice in it. Now you have specialty concierge, you have cardiology concierge, you have GI concierge. So
is that solving a problem, or is that causing another problem?
nope, that is solving a problem for doctors, right? But it's not solving a problem for
the patient.
population as a
Yeah.
general.
Yeah.
People who
So I remember my wife's original doctor. I'm going back when we were in our 20s.
Mhm.
We got a letter saying that he was going to this concierge service, and like if I wanted to be involved in it, it's going to cost me like $5,000 up front.
Mm.
And as a 20-year-old kid with kids getting started out, that might as well have been $50,000. Like,
Correct.
so enough, there was enough kickback. They're like, oh, never mind, we're going to scrap that.
Mm-hmm.
So, yeah.
Yeah, so right now you're in a great position and all, but majority of Americans are your 20-year-old version,
Yeah, I know.
right? Where I feel great right now. I don't think I need anything. I think I'm just gonna stick to urgent care, or I'll just go see the doctor when I have.
Yeah.
But you have other models too that came to solve that problem, which is called direct primary care. Direct primary care is pay for a fee for service. So you come in, you're a member, but you come in, you only pay if you come in and see the doctor that day.
Okay.
That's geared towards real primary care, not towards preventive care, right? You come and see me once or twice a year, you pay $200, $300, $400 a visit, whatever it is. You pay less money, but you get less of me as well. But a lot of these people don't have insurance, and this is the way out of that. And then you have the new services that are coming out, the tele services, the telehealth services, Hims and Hers, and all these big companies where you log in, you talk to a doctor. I think it's solving a big problem, but it's creating another problem.
The telehealth is solving a problem.
It's solving a part of the problem, but it's creating a different kind of problem.
I like the telehealth. It's nice just be on call and say, I need my prescription filled. It's convenient. So what is the problem that it's creating?
So it is not addressing the big problem of traditional medicine. It's making it easier for you as a patient, because you can call and get your prescription filled and you don't have to drive anywhere.
Right.
It's good for urgent issues. I have a sore throat, I have a red eye, whatever it is. But it is not something that you're going to experience like what you experience with models like ours, where you can sit down and you have all these testing. Because even the telehealth, you're going to call, next time you call, you're going to speak with somebody else.
Yeah.
Right? It's not going to be the same person over and over.
Got it.
During COVID, there was not a lot of work as well. So I did some of that work back then. It's not, it was funny. It's actually a texting app. So I would be texting with a patient.
Wow.
Yeah, it was ridiculous. I mean, it solves a problem. Don't get me wrong. It solves a problem for, young kids in college who, have an earache, or they have a sore throat, or they want a letter for their work, for their college, something like that, right? Usual, there's something that honestly today AI can solve with no problem.
Really?
Yeah, no, I think if we sit down again in a year here, we probably have to prepare ourselves that a lot of that work will be solved by AI, and I have a lot of faith in that. I think if you combine the telehealth services and you combine something like direct primary care, and you can come up with some sort of model where you can help people create their preventive care, create a platform where you can plug in your information, something like in the AI version where you can plug in your information, guides you through it, tells you here's what you have to do in a legitimate medical way, not that this is what we think 1, 2, 3, 4, but please call your doctor, right? You would actually get legitimate advice. I think that would solve a lot of the problems. But I think the biggest solution here is education. What I say when we first started, longevity is very simple. I think the biggest hurdle in it is really at that age when you get yourself into that journey, is to know if there's something going on. If you understand there's nothing going on, the rest of it is education. Just you have to understand what food does to you, what exercise is good, what is too much exercise, what is good sleep, what is bad sleep. If you put in these 4 metrics, sleep, resistance training,
let's get it. There you go.
food, and stress level control, you're golden. You're golden. You achieved 85 to 90% of your health goals.
Okay, so I want everybody to hear this.
Yeah.
When it comes to taking your own health into your own hands and managing your own health, what were the 4 things you just said?
Sleep.
All right.
So we're talking about 7 to 8 hours of quality sleep every night.
Okay, so you and I can vibe with this because you don't get good sleep by staying up till 10 o'clock at night watching TV and then saying, okay, I'm going to go to sleep.
Correct.
You need to set your body to prepare for sleep. You don't just go to sleep, right? You got to prepare. You got to wind down, right?
Right.
So we can talk about any of the stuff that vibes you. We can talk about it, or you can keep going. So let's just hit them first, and then maybe we can back up.
I think that is a very good educational point of view
Let's
here.
do
That
it.
people listen to this, they're going to appreciate that.
So sleep is number one.
Number one is sleep. Everything we just talked about, right? If you don't have good sleep, nothing's going to work. You're going to actually regress. So sleep starts in the morning.
Wow.
Starts when you wake up. You go out to the sun, you connect with nature, because we as humans progressed so much faster. Our technology progressed so much faster than our bodies did. Our bodies are the same for the last 10,000 years. But the machinery, the lifestyle, the technology is completely different, right?
Got it.
So back in the day, right, your grandfather, or maybe your father, woke up at 4 or 5 in the morning, got out to the field, worked, got home, sunset, there's no power, there's no electricity, they ate dinner and they went to bed, right? Right now, we don't have that. It's all halogen lights. Kids are sitting in school for 8 hours. This position is not a natural position, right? 8 hours, they go out for 20 minutes outside, they eat, God knows what kind of lunch it is. And that's it, that's the life cycle. So first thing I say when we talk about sleep is that morning sunlight. If you live in an area where you can get that morning sunlight, even if it's cloudy, even if it's a little cold, that 10 minutes, you don't know how much of a good effect it has on you. The sun hitting your skin activates a cascade of events that is very anti-inflammatory. So certain chemicals in your body actually start climbing in the morning once the sun hits the skin. It's very like our bodies are so complex and complicated, a lot more than what we think. Even the sun hitting your skin is going to create that change. Sun hitting your eye, the back of your eye, that's why no sunglasses in the morning. Hitting the retina. Once that happens, the melatonin turns off, right? When the melatonin turns off, the melatonin is the stuff you buy over the counter from the drugstore to sleep. The reason you buy it is because your melatonin is all over the place because, as you said, you're up 10, 11 o'clock watching TV or on your phone. That blue light is telling your body, hey, listen, it's still daytime. It's daytime, it's nighttime, but no, it's still daytime. Don't worry about it. You're sleepy, but your mind is not, it's not ready. So you go to sleep.
Man, bro, you're hitting like 90% of the population right now.
Right.
That's like all of us.
And I think it's gonna resonate well with a lot of people. You think that you're sleepy and you're tired. You sleep and you wake up 2-3 hours later.
That's true.
Yeah. The reason you do this is because your body thinks that it's daytime. And you have a tough time going back to sleep. It takes you 2 hours, you fall back asleep, and then you wake up at 6, 7 in the morning to go to work, and you're a zombie all day. And you don't have, when you wake up, like when this happens, you don't have time to go in the morning. You're not in the mood to go for a walk in the morning. You're just rushing. You get the kids ready, get their lunch ready, and whatever it is, right? So first thing in the morning, going out to break that cycle. Go out for 15 to 20 minutes. The longer, the better. That morning sunlight, get the sun in. Sometimes it doesn't work out. That's fine. It is what it is. Sometimes we have to go to leave home before the sun is up, but that's okay. Second thing is set a sleep hygiene, which means sleep schedule. If sleeping and waking up should be at the same time every day. So you want to sleep 7 hours a night. You set yourself to be in bed for about 8 hours because there's about an hour of tossing and turning, getting up to go to the bathroom, etc. So 11 p.m. to 7 p.m. or 10 to 6. That's 8 hours. Every day should be the same time. So that's the sleep hygiene. Number 3, avoiding any screen. 30 to 45 minutes heading up to bed. If you have to, absolutely have to, there are certain glasses that block the blue light. Phones today, they have some sort of blue light filter. Eating, heading to bed towards bedtime, nighttime should not be any digestion going on. Nighttime is for brain cleanup. Nighttime is for your
This is
body
practical stuff, man. And
Yeah.
this stuff is simple and it's cheap.
100%. 100%. Yeah.
This is helping. This is going to help a lot of people.
Yeah. So eating 3 hours before a meal shorter than 3 hours before bedtime is not a good idea, because you're going to be digesting going to bed, and your body is not ready for that. Your body is not meant to digest food at nighttime. Your body is meant to rest the gut at nighttime.
Wow.
A lot of people also would have reflux issues, etc. The blood sugar goes all over the place. So all these sleep hygiene techniques are going to help people sleep better, get better quality. And even if you think that you sleep very well, if you apply these metrics, your quality of sleep will be better. Right? Now, we're not even talking about sleep apnea yet here. Sleep apnea is where people stop breathing at nighttime multiple times an hour, and that restricts blood flow, restricts oxygen, which makes, a lot of issues. I screen a lot of people for sleep apnea, but that's a medical issue that needs, a little more hands-on
Understood.
work.
We're just talking about basics right now.
Basic stuff that you can do at home.
Yep.
Right? Now, if you're still having trouble, melatonin is a good option. Melatonin, that's just melatonin. Magnesium glycinate at nighttime. That's going to help you relax your body a little bit. Meditation. You have two forms of nervous system. I'm wearing the Whoop here, and that a lot of people wear that, or the Oura Ring or whatever. That measures a lot of variables related to your heart rate. There's something called heart rate variability, which is a result of constant push and pull between a nervous system called sympathetic nervous system and another one called parasympathetic nervous system. Sympathetic nervous system is when you're working out, you're going, you're yelling at your employee, you're having a big meeting. This is sympathetic nervous system. Parasympathetic is your, with your grandchild, you're relaxed, you have him on your lap, and you have like that relaxed feeling. These are two different forms of nervous systems. Towards the end of the day, you want to turn off the sympathetic and turn on the parasympathetic.
So practically speaking, shut the emails off. Put your phone on. Put your phone on like sleep mode, and start winding that stuff down.
Winding down. Meditate for 5 minutes. Sit down. Practicing gratitude. Right. Practicing gratitude actually has some benefits, medical benefits.
It's amazing, isn't it?
And just writing and journaling. Just reflecting on your day, and there's a lot of things that would turn off that sympathetic system, because if you do not turn that off, you're in trouble at nighttime. Your body's not resting well, right? So I think all these tips, put them together, is going to create a better quality of sleep, and is going to get people to sleep better. I think that's when it comes to sleep. Food, very simple, and this is going to be the shortest one. You eat out of these categories: meat, red meat, chicken, fish, eggs, fruits, vegetables, coffee and tea, and nuts. That's it. Nothing else. If you do this 80% of the time, you're good, right? If you want to eat an ice cream every now and then, if
okay, so
if you're watching,
hold on a minute. What you just said, again, I'm putting myself back in my 20-year-old shoes. Like, some of that stuff that you talked about is more expensive than the pack of hot dogs for 99 cents, or the buy one, get one free hot dogs. You follow me? But I think you and I had a conversation before that in the long run, the quality of food is not cheaper. It's the garbage food over the long period of time that is more expensive, because it has an effect on your health.
Absolutely. Absolutely. It's like paying your credit card minimum payment, right?
Got it.
So if you pay up front, you're not going to pay interest. But if you do minimum payments, you're going to continue to pay interest until, you end up paying triple the credit card amount.
Quality of food is one of the keys to being healthy. So if you can find somewhere else in the budget to scrape, you would put that extra money in food?
Absolutely.
Okay.
Absolutely. At the end of the day, I think it is not, let's just be real. I think it's not just the price. I think it's the convenience,
Understood.
right?
You're
Uh,
right.
yeah.
You're
So,
right.
is it cheaper to go buy a family meal from McDonald's or KFC? Of course. Um, but here's what I argue. You, Keith, in the morning, you wake up and I give you two options to eat: waffles and pancakes and fried chicken, right? Or 3 eggs and avocado.
Mm,
Which one is going to give you a more productive day,
the second.
right? So if you look at it from that perspective, if I eat a healthier meal, I'm actually going to do better in my job. I have better chances of producing better. If you're self-employed, you have more chances to recruit more clients or more business that day. You are not hitting that midday fatigue and you don't know what to do with yourself and you really want to take a nap. So on the long run, no, we're not talking about a very long run. We're not talking about 50 years. We're talking about 5 to 10 years. It is much cheaper to eat healthy food. And you're going to need less food because
Understood.
when you eat a hamburger from McDonald's or a fast food chain or whatever it is, there's a lot of carbohydrates in that, right? And a lot of sugary condiments
Fillers.
and whatever it
Yeah.
is, right? What that's going to do is that's going to spike your blood sugar. And that's going to spike your insulin. What does that do? That's going to tell you that you're hungry quicker.
Mm,
So you're going to need another meal in about 4 to 5 hours. But if you eat the meal I just told you about, 3 eggs, half an avocado, you're going to be full for a good 6, 7 hours. So you're going to actually eat less. If you eat more protein and more fats, then you eat carbohydrates, especially refined carbohydrates. So that's another argument against the price. Would it still be a problem? Absolutely. Yes, you're going to still have people who unfortunately just can't afford it. What do? You make the best out of it.
make the best out of it.
Make the
Yeah.
best out of it. Whatever you can do. If there's one day a week where you can go grocery shopping and buy, yes, do that better than buying yourself the most, the newest iPhone, right?
Understood. Nobody's ever gonna get it 100%.
No,
But just try to get as close as you can with what you got.
absolutely,
Understood.
absolutely.
This is practical stuff.
Yeah.
Thank you.
Water,
Let's get it.
100 ounces a day. Yeah, easy, right? Easy to remember. 100 ounces a day of water. Wake up, half of this bottle. How much is this? A liter? 800
so.
mLs. So a little less than a liter. So 27 ounces. So about 20 ounces when you wake up in the morning, get everything going. You're going to feel better. You're going to feel more refreshed. Going to get your bowels going. So it's going to get that habit in. And that's 20 ounces out. Because I can tell you that 50% of my patients, they come to me with less than 40 ounces of water a day. These people are chronically dehydrated. It's unreal. Once they start drinking water.
Say that statistic one more time.
50% of my patients, they drink, when they walk in through the door, they drink less than 40 ounces a day of water.
Okay, so this hits close to home because I have a son and a wife that they say water hurts their stomach.
Mm.
Like they say water actually hurts. Like me, I can drink lukewarm water and it like feels good. Like cold water hurts, but like lukewarm water. So for someone who says that they just can't get the water in or it hurts, like hurts your stomach, is there a solution to that? Is that is that a common thing or is that uncommon?
It's not that common. It's not that common.
It's not common.
You probably, a person like that would probably not drink the 20 ounces over 15 seconds. I wonder if they have symptoms if they drink the 20 ounces over, 30-minute period of time.
Understood. Got it.
Make it a little slower. Play
So
with the
maybe
temperatures.
Everybody has those, like, what do you call them? Those Stanley,
Yetis
those
or
Stanley
Stanley, yeah.
or flask or a Yeti.
Yeah.
Maybe just fill it up and just have it and just
Sip on it.
sip
all day.
on it.
Yeah,
Got
and
it.
if it helps, you want to add some electrolytes or some taste to it, go for it.
Understood.
Yeah.
So we got sunlight, we got sleep, we got food,
Stress.
we have water.
Water.
Does it matter? I've heard the term dead water. Is all water the same? Should we add electrolytes to our water? Should we add salt to our water? Like,
You should.
we're going to get into toxins at some point, but like bottled water, like what when we get into when we're talking about water,
Mm.
is
really-
there a does it is there are there tiers to water?
Yes. So not all water is equal. So you're on well water, right?
Yes, sir.
Okay. So I mean that has its own problems, but it's a lot better than our city water. I'm talking about our county. So our city water is filled with chlorine, and the chlorine. Think about it this way. What does chlorine do to the water? Well, why do they add chlorine? Just to kill bugs, bacteria, right?
Mm-hmm.
What do you think the chlorine is going to do to your bacteria, your own bacteria? And do the same thing, right? So what I recommend, again, this is unfortunately not very affordable to everybody, but a filtration system that cleans up the chlorine.
Okay.
In addition to that, you do an RO system, but after you do the RO system, you add minerals back.
Understood.
So yes, there's the dead water, which is basically distilled water that has no electrolytes in it. If that is not an option, I think bottled water, preferably in a glass bottle, but these are expensive. But then you get into microplastics, which we'll check on a little bit. My preference would be if you have that filtration system and you have that going at home. If not, you have also the small filtration systems you can buy, and you can just forget the name of these. It's like a carbon
Like a carbon filter.
a carbon filter that does not remove all the electrolytes but removes the toxins.
Understood.
I'm more worried about the toxins in the water, the chlorine in the water,
You're more worried about the chlorine and the toxins in the water.
than the actual electrolytes, because a lot of people do the RO water because they want to preserve their equipment, the fridge and all that stuff, which is great, but from the health perspective, the chlorine is gonna destroy everything, right? So if you don't have a legitimate RO system and a system that even on RO without a chloramine filter is still not going to remove all the chlorine. So you can tell the difference. When I installed it, I immediately know when it broke because the taste immediately changed. You can
Wow.
smell and drink the chlorine and taste it. So when it comes to bottled water, I think glass is your best option. But yeah, there's not a fact, piece of information cannot verify. Even if you have a plastic cap, I'm not sure if that's plastic or not. You still have a good amount of plastic contamination in the water, even if it's a glass bottle.
So sounds like water's a little more complex.
It is more complex. Now, if you live on well water, it is a hefty process to get your water up there, but that's well water. It's clean. It has not been processed. It does not have chemicals as much as as far as you know. It has the natural chemicals in it, but you're taking care of that. But chlorine really, really worries me. And aesthetically too, it gets dry skin. People starts getting their hair, falling hair and bloating, and it's incredible. What it can do to you. So that is when it comes to water. And the last pillar is stress, and I'm going to combine it with social life.
Let's hear it.
So stress. Let's go back up a little bit. You know what a telomere is?
I've heard the term, and I heard that as you get older, they get shorter.
Right?
I hear these terms, and
Yeah.
I'm familiar with them for a little while, and then I
Mhm.
lose it. So telomeres, I've heard, is as you get older, they get shorter.
Correct. Shorter and more ugly, right? Think about the DNA as your shoelace. That's your
Okay.
DNA. The end of the shoelace, it has a little plastic cap on it, right?
Yep.
So that is your telomere.
Okay.
And as the shoe gets older, what happens with that plastic cap? It gets like getting loose and loose and loose, and you get that thread coming out.
Yep.
This is exactly what happens on your DNA.
Okay.
So that gets shorter and shorter. One thing that affects telomeres negatively across the board in all the studies that were done, stress. Specifically health-related stress, right? If you're taking care of a sick person or you have a sick loved one, yeah. But that applies to a lot of stresses. How do we cope with stress? That's a whole episode, right? To go through. There are professionals that can help you with that. online professionals, I really think that they're great when it comes to that, because they do spend the time. They sit down with you 30, 45 minutes. They go through your family history. They go through your childhood. They talk about why are you stressed out. 95% of the things you're stressed out about never happen,
That's true.
you know? But you and I know that it's easier said than done.
Yeah.
We are all getting stressed. The thing is, you cannot control what hits you.
So what I want to do is, you talked about you can hire these psychologists to help you with your stress. I want to talk about
Practical.
the family that's
Close.
trying to make it happen.
Yeah.
Right. That growing family, that
Yeah.
20-year-old Keith.
Right.
So what does 20-year-old Keith do that he can afford when it comes to managing stress?
If you understand this concept and you put this in your mind, first of all, 95% of your things you're stressed out about, it's not
Never
going to happen.
happen.
2, you cannot control stress. You cannot control what's going to hit you. You cannot control the events. You can control how you react to it. Okay?
Say that one more time.
You cannot control what hits you, but you can control
Your reactions.
how you react towards it.
Okay.
Right? So, example. Simple, driving, right? Somebody cuts you off. You cannot control that person. They cut you off. They're not good drivers. They're rude. You can control your rage.
Yes, sir.
You can stop yourself from chasing him. You can stop yourself from yelling. You can stop yourself from cursing and sounding the horn. All what it takes is take a deep breath 2-3 times and move on. I recommend, if somebody wants...
So when your mother used to tell you to count to 3,
that's it.
that was a real thing.
Yeah, before
Count
you do
to 3.
anything.
Take a deep breath and count to 3.
Yeah.
That was a real thing.
Yeah. Another trick: do not make any decisions under stress. Wait if there is, or under emotional pressure.
Understood.
If there is something emotional going on and you are about to make a decision, all what you have to wait is 90 seconds.
Really?
90 seconds and that wave's going to go. If you still have the urge to do that, make that decision, do it. Most likely that urge is going to go away and you're going to go back to your sane mind and make that decision. 3, breathing techniques. That's days of practice. But there's a book called Breathe. Simple as that. And read it, understand about breathing techniques. You can do so much through breathing. There's the breathings like 4 on, 4 off, 4 on, 4 off.
There's box breathing. I was doing box breathing for a while. Yeah.
The way that you breathe. I think if I want to choose one thing that controls your stress and stress response is your breathing.
Wow.
If you control your breathing and if you understand how your breathing affects your nervous system, and it really connects with meditation too. 5 minutes at the end of the day, it kind of is going to help you. Stress is going to keep your sympathetic system, remember I talked about it a bit ago, always on alert. And that is not a good thing. This is how these watches measure your stress level. They measure your sympathetic system. So if you apply these 3 concepts, understand what stress is, understand that your response is what matters, and understand how you breathe, you solved a good amount of that stress.
One thing I learned recently is me personally, I try to take care of everybody. And I changed one word. This was awesome, dude. This took stress off me. I'm responsible to people. I have responsibilities to my wife. I have responsibilities to my children. I have responsibilities to my employees. I have responsibility to you. But I'm not responsible for people. And that just took a lot of stress off of me because I was always trying to be responsible for people. And that lowered my stress level. I have responsibilities to you. Just 2 little small words, just changing those 2 words out, a 4 to a 2.
Absolutely.
It helped me. It helped me. It was like I was able to take my cape off.
Yeah.
And Keith, you don't have to save everybody. You have responsibilities to people, but you're not responsible for everybody. And that was a major thing that drove my stress levels
down.
Especially as my family's been getting bigger and there's more and more of them that I feel like I'm responsible for. Like my son-in-law, my daughter, they're renting a house. They need a house. You know, I mean, everything's getting more and more expensive. Will they ever be able to afford a house? Trying to like figure out all these things. I'm not responsible for that. I'm responsible to them, but I'm not for them. That helped me.
People's happiness is not your responsibility, right? You are absolutely correct about that. And I think if you apply that term and, people pleasing, people pleasers are the most stressed out people, right? Because they're trying to make everybody happy, and that is impossible. So I think if you understand what you just said very well, and you know that you're responsible for you
That's it.
and how you react,
That's it.
your wife or your spouse, your neighbor can be upset. They can say whatever they want to say. You cannot be rude. You have to be respectful. You have to keep your boundaries. That does not give you a green light to do whatever you want.
Understood.
But that is on them. It's not on you.
It's
Of course, you have
liberating.
to have sympathy. You have to have sympathy towards your spouse who is upset or who is angry. You have to try to understand, but you do your best. But if at the end of the day, it is their responsibility to take care of that, it's not yours. And that removes a lot of burden. And absolutely, as you said, your stress levels are going to start coming down.
Is there anything else about stress you want to talk about?
So I wanted to connect this with social life.
Oh yeah, thank you.
So there is a clear connection, and I think you and I talked about this during the other podcast. Is there's a clear connection between social life and dementia. The less social you are, the more likelihood you're going to have memory problems, especially
Wow.
towards end of life. The study that was a hallmark study actually was done in postmenopausal women after their menopause. If they have less social connections, they fared a lot worse when it comes to their mental health and mental performance. So continue to mingle, continue to see people, do not get isolated, because as people get older, they have a tendency to stick to their routine and stay away. So I really honestly, if you allow me here, I'm going to go back a little bit in my personal history and
Let's hear it.
where I grew up. I grew up in Jordan, in the Middle East. It's probably hitting a little bit of the headlines right now because they're in the World Cup, but it's a small country in the Middle East, so there's a lot of cultural things that they would never change. So you would go there, a 60-year-old man there just waiting for himself to die. Basically, 60, I'm done. I'm done with life, right?
Really?
Yeah, I mean, that's it. Like 60, I've done it all. I'm retired. My kids are grown. That's it. I'm done, right? Not necessarily they're sick, but they're like, quote unquote, old. You come here, go to, Naples is not a great example, but I think you can generalize that. A 90-year-old person would still be trying to live, right? Still trying to have a good life. Not everybody can afford the lavish lifestyle in Naples, obviously, but you still have, you still see a lot of older people going out, enjoying themselves, going out for dinner, embracing their retirement, traveling, a lot of that stuff. It's generalization, I know, but you see that, and to me that's very striking, because where I came from, when you're old and you're mingling a lot, or you're going around and you're being social, people look at you weird. Oh, what you're doing? You did your time, man. That's it. You're done. Move over. Next person.
Wow.
Right? And that's how it is. That's how you have a few people who get out of the cycle, but that's, I think, I guess, a cultural thing. But at the same time, I got to give it to that culture too. Nobody ends up in a nursing home. There's always a family member who's taking care of that. Nursing homes do not exist really virtually.
In Jordan.
Yeah. I mean, they're going to be out of business because nobody wants to send their family to a nursing home or a rehab center or any of that stuff. So that's when, if you cover all these pillars we talked about, you solved 85% of your problems, and you prevented more than 90% of your diseases.
I want to ask you two more questions, and then I want to move to another chapter. When you mentioned social life, would social media interface be included in social life, or does it have to be face-to-face? Does it have to be doing something physically?
Yeah, because in social media, you're only engaging very little out of your emotions.
So find a hobby, find a group of people with common
Yeah.
interests. Go do some knitting. Go
Yeah.
play cards.
Go visit your family.
go do
Go out with
something.
your wife. Meet other people. Yeah.
Okay. We talked sunlight. We talked nutrition. We talked sleep. We talked anxiety and stress. We talked social life.
Mm-hmm.
You haven't talked about lifting heavy weight yet, I don't think. Have we
Oh, yeah,
talked-
we missed that one.
How
So,
important is
oof.
weight training or stress in the body?
Oh, yeah, absolutely. I just posted something on my page actually on Instagram this morning about an article that came out 2 months ago. The article looked at something called the biological age. So the biological age, in a nutshell, what it is they check your DNA and they check certain changes on the DNA, and they get millions of samples, and they build algorithms, and based on these algorithms and mathematical calculations, they can determine how truly old you are. Right. So you're 50, your DNA age or your epigenetic age is 45, or you're 55.
Understood.
So the nice thing about it is trackable. So you can do it on a yearly basis. I think we should do it for you actually.
Let's do it.
And you can see what your interventions are doing. Are your interventions making things worse, better, etc.? Especially in a controlled environment like mine, right? I virtually control or actually know all of your health related issues. So this article looked at all the interventions that were done and looked at the effect on that biological age. The supplements that were super strong there were omegas and vitamin D, omega 3 and vitamin D. But on top of the list was resistance training.
Mm.
So resistance training improves your muscle mass, improves your insulin resistance, improves your mental well-being. If you get a 70-year-old man and you slap 5 pounds of muscle on them, they immediately become healthier.
Mm.
Their bone health, their heart health, their lipids, the way they feel, the way they sleep. If they fall, they don't break as much. Their balance is better. So longevity, and we did that for you, is that grip strength. Remember?
Yeah.
The stronger your grip, the longer you're gonna live. Straight line.
Yeah.
So, as I tell people, lift that heavy weight, put it down, eat healthy, rest your body and sleep. You're good to go.
It's simple.
Simple.
It's not expensive.
It's not expensive.
Okay.
It's not expensive.
I like simple things because I can do simple things. If you
Mhm.
make it too complicated, I won't do it.
Yeah.
It's got to be simple, brother.
Mm-hmm.
And you just made it extremely simple. And also, simple eliminates excuses.
Yes.
If I can understand it, I have no excuse not to do it.
Mhm.
I appreciate you being here.
Yeah,
I don't
of
want
course.
to rush this. Let's take a little break. What do you want to talk about next? You want to talk about influencers and peptides, or do you want to talk about toxins? What are you feeling? We're going to talk about all of it anyway, but which one are you feeling right now?
Let's do the influencers.
Let's get it.
Let's do influencers and peptides and get on my chest.
Yeah. All right, let's do it.
This is a chip.
This part of the podcast is brought to you by Vance Ranch. Vance Ranch is our family 100-acre ranch in Hendry County. We have a 6,000 square foot barn where we host wedding venues, corporate events, anniversary parties, and whatever else you want to use it for. Find the link in the bio. Now let's get back to the show. All right, brother, we're back.
All right.
All right, so toxins. We hear
Yep.
about microplastics. We hear about heavy metals.
Mm-hmm.
I heard that a baby's first poop has microplastics in it. I hear microplastics are in every living thing in the world, like fish. So obviously this is the world which we live in.
Mm-hmm.
What's the pathway forward? A coffee cup.
Yeah.
You get a coffee cup from Starbucks, that lining has microplastics,
Right.
and that hot coffee goes in there and that breaks down, and we're
Yeah.
ingesting that. Some of that stuff I heard actually crosses the blood-brain barrier, and we still don't know what the effects of that is. So this is your wheelhouse. Try not to freak me out, but give it to me the way it is, how it is, and what's the best path forward.
You're not gonna like my answer, but
I knew it. I knew it.
the answer is there's not a whole lot you can do about it right now. Two challenges. Number one, it's very hard to check for microplastics, right? So we don't have a good test for it right now. So it is very hard to actually quantify it. So that's the first thing. Second thing is the way the world is operating right now, 7 billion people, you're going to get microplastics. You know, um, you can control small things, but in the grand scheme of things, you're not controlling much. You can control your water. You have personal control of your water, right? You can control your silverware. You can control what you put your food in. You can control that you don't drink coffee at Starbucks. You can bring your own mug. But there is not a whole lot to do about the plastic you have currently and where you sit at it right now. Where do you sit right now with how much plastic you have? That is unfortunate reality. And this is one challenging thing. And I think there is a lot of weight on it right now. There's a lot of going on there. But
That's a good thing.
everybody knows that so far we don't know what to do about it. There is one intervention that has been promoted, which is plasmapheresis. So they hook you up to something like a dialysis machine, right? And they run your blood through it through filters, and they pump back the blood. They dump the plasma, and they give you some albumin instead of that. So remember the article I talked about a little bit ago? That intervention shortens your lifespan. You know, makes your biological age longer. So it actually ages you. So yeah, great. We got rid of your microplastics, but we made everything else worse, right?
So you know what's funny is I just saw a video on social media. This influencer guy, and he was hooked up to that like a dialysis, and
Yeah.
they were taking the microplastics out of him, and it was like in this little vial, and it looked a certain color. So you're saying that actually that process actually shortens your lifespan?
So that process is a very, very old process, and we've
Okay.
used it for many diseases. So people with certain cancers, etc., blood cancers, we were able to filter out the blood. The whole process is basically you take the blood, you filter it out, you dump the plasma. The plasma is the part of the blood that is not cellular, doesn't have cells. It has liquid, it has proteins, it has toxins, it has all that. And that's the whole idea of it. We clean you out of the toxins, we filter the toxins out, we dump a bunch of albumin, and we replace that, and you're supposed to just be quote unquote cleaned up. In theory, great concept. So far, studies have not shown that much benefit.
Okay.
Yeah. So yeah, he could have removed the microplastics, but again, I get back and say microplastic per concept, they're harmful. But you don't want to try to fix harm by causing more harm. You know?
Mm.
So that is my take on microplastic. Unfortunately, there's only so much you can do when it comes to controlling it. And because it's a forever chemical,
Yeah.
it's just not going to go anywhere. The microplastics you may have ingested when you were 20 years old, you know?
I had a farmer on this podcast. He's been farming for 55 years. Good dude, salt of the earth guy. Like, I'm thankful for farmers. But they put the plastic down for the rows to keep the weeds down. You know, when they get done harvesting the crop, you know what they do with that plastic? They burn it. They burn the plastic. You know where that plastic goes? Into the soil. And then the next crop comes. So there's no getting away from microplastics. Like, it is everywhere.
Yeah.
It's everywhere.
It's everywhere. You control, what we're trying to control is the end step. There's so many steps, as you said, farming, the fish in the water, how they caught the fish, how they processed the fish, how they got the cow, what did the cow eat, what did the plant, what kind of fertilizer you used. All the stuff I told you that you control is that the last step. You're not controlling that much,
Got it.
So
do we know what harm microplastics cause? I heard that they cause infertility in men.
Correct. So men have 50% less sperm count today as 50 years ago. So if we don't fix this problem, we're going to go extinct.
Mm,
How's that for optimistic?
well,
Yeah. There's no sperm, there's no babies. So, yeah.
you know what's sad is?
Mm.
What's sad is my 18-year-old daughter told me that.
Mm.
And that's what she's worried about right now. She's worried that by the time she gets married, she may not be able to have kids because of microplastics.
She'll have kids.
What a
Maybe-
freaking thing for an 18-year-old to be worrying about.
Right. Right. Well, she's going to be okay. Her daughter's going to be okay. Her granddaughter might be okay. But then after that, I don't know. Now, I'm really hopeful for humanity to find a solution. But if we're going to tap into plastics and who makes plastics and why plastic is made and why are we using it and the oil industry and the petroleum industry, it's a losing game.
It's a losing game because as long as there's money being made, it's going to keep on rolling.
Yeah, it's cheap. And
Yeah.
So that's my opinion on it. But the more natural you live, the more you isolate yourself from boxing and processed food. Because even controlling that last step could be important. Because if you think about it, remember the food categories we talked about. If you're limiting yourself to that food category, you're not going to go eat something out of box. You're not gonna go eat a bag of chips. You're not gonna go eat, that hot dog you talked about. How much plastic? That's the whole thing is plastic. It's you can't control that part of it. I think the more you do it, the more you teach your kids to do it. Because here's the thing: you started doing this stuff recently, right? You call it 10 years. But if your daughter, she's worried about it, it's heartbreaking that kids are worried about it today. But at the same time, she's aware.
Yeah.
And she knows and she understands. And that is a driver for her to stay healthy, eat healthy,
Listen,
eat out of the farm.
that girl bought our family toothbrushes that are bamboo to get rid of the plastics.
Mm,
She's like slowly just going room by room and saying, okay, what can I control
amazing.
at 18 years old? So hopefully she's not an extreme case.
Mhm.
Hopefully this younger generation is all aware of it and change can happen, right?
Yeah.
Hopefully. So
Yeah.
I'm always trying to land on optimism
Right. Absolutely.
because this will drive me crazy.
Yeah. Yeah. That generation is, if we're going to diverge back a little bit here, that generation, I don't know what they call them. They're not Gen Z, they're younger than Gen Z. They were born into this, what we
Yeah.
live today. Some of them were born into Facebook and Instagram and YouTube
Yeah.
and all that stuff. And I think a lot of them are going back to what you and I were when you were younger.
That's good.
I have a little bit more hope in them. And I think humanity eventually is going to survive, right? We're not going to witness it. Our kids are not going to witness it. But there's a lot of good that will happen. Good will always prevail. I think we'll be able to survive. At the end of the day, it's a matter of survival, right? We are at the end of the day, we're animals. We need to survive. So, the other harms of microplastics is cardiovascular disease. Straight up, it causes plaque formation,
Okay.
blood vessel disease. We don't know much about the brain yet, but these two, the cardiovascular disease and infertility, but I can tell you a ton of cancers, right? Cancer formation. These are things that the body doesn't know what to do with. That's why it causes cardiovascular disease. The body tries to engulf it and just sit on it because it really has no idea what that is. So we're just going to we're going to attack it as if it's, an invader, and it is.
That's the amazing thing about the amazing thing about the body is it tries to heal itself.
Yeah.
Like it's an amazing machine.
It is. It is.
Yeah.
Yeah. So other toxins that we get worried about mainly are heavy metals. Heavy metals are a lot more controllable. You
What
know,
are heavy metals?
so we're talking about lead, talking about mercury. These are the two biggest ones.
How are we ingesting those practically? Because I don't drink mercury, I don't think, or I don't
Fish,
fish.
fish, tuna. The good thing about this is we can test for it.
Okay.
The test is easy. And we usually don't test unless somebody has certain exposure or they have symptoms. These are usually not symptom free. The heavy metals are not symptom free. Like somebody would come in, you do everything under the sun, they're still brain fogged, they still can't get up, they still can't do much. You check their lead level. That is out of my wheelhouse. We send them out to a chelation therapy. So it's a form of IV therapy where you put a sort of IV in their body and it chelates the heavy metal and dumps it out. And it is controllable. Mercury is controllable by not eating sushi every day. But again, I go back to the thing of with testing. Testing is key. If you're able to test for something, good. We're able to test for them. We're able to monitor them. In fact, if I do a test for somebody and their mercury comes back high, Collier County calls me immediately. Like, what are we doing about it? Are we going to send them out? We just need to report it to the state, etc. So there's a lot of awareness there. Lead is paints, not currently, previously. So the old paints,
Yeah.
it has lead. And people who live in old houses, people up north who live in old houses, we're lucky enough here that our houses are fairly new.
Right.
They're exposed to a lot of lead, a lot of detrimental health effects, mainly on the brain.
How do you ingest lead from paint? I mean, they're not eating paint off the walls.
Oh, yeah, they are. Kids are.
Oh,
Yeah. And it stays with you.
wow.
A lot of people eat soil.
Got it.
Kids, yeah.
I just thought of something, and I don't know if you can speak to it or not. If you can't, don't worry about it. But you mentioned sushi, and there's this thing on my social media algorithm about parasites. They say, hey, you worm your dogs, you worm your cats. People in third world countries get wormed, but Americans don't deworm. Do we have parasites? Is that something that we need to be aware of?
If you don't have symptoms, no. Right? So if you don't have unexplained iron deficiency, if you don't have any unexplained weight loss, unexplained fatigue, bloating symptoms in the abdomen, anything like that, you don't need to worry about it. If you have symptoms, yeah, we test for it and you can deworm. But
is it common in the States? It's not common. Okay.
I do not have a single case.
Okay.
And we test a lot.
Well, good. At least that's one thing. We're gonna have microplastics, but at least I don't have worms.
Yeah. Worms are easy though. They're easy. Worms you can't kill them. Though here's a situation with parasites.
What sparked my memory was the sushi.
The sushi, yeah.
That's what sparked my memory about the parasites.
So from here, I want to probably use that point to move on to the next chapter, which is how parasites they were blown out of proportion. Now, you would get somebody who would blame every little bad thing about their health on parasites. They drink 3 drinks a day, eat like garbage, don't exercise, and then yet they come and insist they want to test for parasites because that's a problem. And I'm like, nah, you got this wrong, right? So this is where influencers are a problem.
All right, here we go.
Let's talk about regulations for a second. Regulations say, if me, a physician, go on social media, everything I say is looked at and reviewed and can put me in trouble. If I, as a physician, go out and say, peptide GHK copper is a great one, you should take it, this is the dose for it, go for it, your knees are going to feel better, your hair is going to grow, you're going to feel youthful again. This could land on the medical board, and the medical board can come and take my license, right? Because I have a license to lose, and I think this is very appropriate. I think that's true. I don't think doctors should be talking about things that are unverified or giving false medical advice or anything like that.
You
Okay.
live to a higher standard.
Yeah.
We trust you.
But Joe in the fire department next door has nothing to lose. Goes to the gym, becomes successful, gets good muscle strength, ends up in the cafeteria in the gym, and they sell him a couple peptides. He uses them. He loves them. He plugs them in ChatGPT. ChatGPT spits it out. What are peptides? He goes on social media and he tells you everything about it. Nobody cares, right? I'm not gonna say names here, but there are very, very prominent influencers that they have products, they have supplements. They talk about peptides like, they created them. They talk about the human biology as if it's their thing. What they do is they're insurance salespeople.
You said they're what?
Insurance salespeople.
They're insurance salespeople.
Yeah, I mean, it's not like health insurance, but they're salespeople. They just know how to sell. They know how to talk,
Understood.
and they make a ton of money doing it, and they have absolutely nothing to lose. And a layperson, when they look at their beautiful setup, they look at their chart, they have 70 million followers, and they have this great branding, and then they have this company that endorses them. Of course, I'm going to listen to them, right? They're not going to listen to Dr. Khader from Naples, who's talking about simplicity and eat your vegetables and you're going to be fine. They're going to
He's
listen,
talking about getting some sunlight,
right? They're going to listen
and going to bed on time.
Yeah, they want
got
to
it.
take the shortcuts. Like, oh my God, this is
Got it.
for example, there is this peptide called epitalon. Epitalon is not very available right now. So even if I want to get it, it's very hard to get. It is available through research compounds and research pharmacies, which are not meant for human use. You hear people with a straight face go on social media and say, this is the fountain of youth and this is the future of medicine. Who are you to talk about this? If I show you a cell and I tell you point to the mitochondria, you will not know where is the mitochondria. Who are you to talk about the cellular benefits of A or B or Z? It is very frustrating because it is a lot of garbage. Majority is garbage. Because people who have a lot of time to do this, they probably don't, they don't see a lot of patients, right? There are a few doctors out there that have very legitimate podcasts. Dr. Huberman, for example, he has legitimate stuff going on. Peter Attia, despite all what happened with him, but they have a lot of legitimate, podcasts and legitimate, medical information. Not endorsing Peter Attia by any means, but people like him, they go out and they talk about simplicity, about what the science really says, what does the research say, what does the experience look like, not what I'll give my neighbor an injection and he felt better, hence the injection works. This is not science, this is pseudoscience. Going to medical school, you are forced to read articles all the time. You have to read it. You have to know how to look at the statistics. You need to understand how to interpret the study. What does this mean? What does the confidence interval mean? What is all the statistic measures in it mean? So when people have accessibility to all these studies, I'm going to give you an example. During summertime, people eat a lot of ice cream. And during summertime, a lot of kids drown. Can you make a connection between drowning and eating ice cream? You can't, right? But in medicine, a lot of associations are made that way. So if I show you a study and it says, and that's a real study, that's a very classic example, a very, very, very prominent influencer with books published, with, sells all these stuff and glasses and peptides and whatever, comes out and says, using melatonin causes heart attacks, okay, or heart failure, whatever he said. When I looked at it, I was intrigued. I was like, whoa, really? So I looked into the study that he quoted. The study says, we pulled up hundreds of thousands of charts from, I don't remember, it was Medicare or the Veterans Affairs, and we looked at people who use melatonin, and we looked at the incidence of cardiac disease in these people. So they never met the people; they just read charts and they did, an insurance run. But Keith, what is the problem with that study? Who takes melatonin? There's a person who cannot sleep,
Mm-hmm.
right? Did it occur to him that, well, wait a second, maybe because this person has not slept well for the last 20 years is why he had a heart attack, not
Right.
why he took that melatonin.
Because he's stressed out and he can't sleep.
Exactly. So he's taking the melatonin. So taking the melatonin and the heart attack are from the same reason, that you're not sleeping well and you have sleep apnea. Same thing when it comes to a lot of hormonal stuff and a lot of bad rep stuff that comes out. So you get somebody who absolutely has no idea what medicine is, who gets a financial benefit out of it, does not know how to read a study, gives you a very false assessment like that, and nobody verifies it, nobody says anything, and he's not in trouble. If anything comes, you know what? I'm sorry. 3 years ago, I was wrong. Who cares, right?
Understood.
So this is the problem with influencers. But as I said when we started, I think this is a result of the frustration of the healthcare system.
Understood.
Healthcare system has failed us, has failed many people, only reacted to disease. It's been amazing in treating disease. It's been amazing in treating heart attacks and preventing death from heart attacks. It's been amazing in helping us understand how we can retrieve a clot from somebody who had a stroke so they can live longer, have no problem. But it failed us in stopping the stroke from happening 30 years before, stopping the heart attack from happening, stopping the recurrent pneumonias, stopping the recurrent infections. It failed us by tricking us to know and think that fat is bad for you and carb is good for you, and failed us when it said that, when it taught us what the food pyramid looks like
Yes.
and what exercise should be, and you should be running every day, and you should not be lifting weights because you're going to hurt your joints. This and on top of all that, it failed us because it became very expensive and unaffordable. If you look at the lifespan of people, of course, today in 2026, people live overall longer than they lived in 1990. Not 1990, 1900, I mean. The two main reasons are surgeries. We are much better at surgeries and sanitation, and antibiotics. It has nothing to do with
Health.
the rest of the treatment. The rest of the treatment maybe added 1 or 2 years, but it did not really help us prevent the disease from happening. The last year of life is the most expensive year in your life when it comes to healthcare. Billions of dollars are spent on the last year of life. Unnecessary testing, unnecessary procedures, unnecessary interventions that added absolutely no quality. It maybe added a month or two of life, but with absolutely no quality. Patients spend it between hospitals, rehabs, hospice care, away from their family with zero quality. So all these collectively, they created a failure of the healthcare system and a disappointment in the healthcare system. It's still good when we need it. If somebody has an appendix that ruptured, you rush to the hospital, you're right there, you're going to get in and you're going to get it taken care of. If you broke a knee, we're very good about arthritis and, replacing knees and hips and all that. And that's a whole different talk. But, I think we made a lot of progress when it comes to orthopedic surgeries, heart attacks. All these heart centers around us are impressive in saving hearts and saving people's life, and fixing strokes and getting rid of the disability that could happen. But we still don't know what to do with Alzheimer's disease. We still don't know what to do with Parkinson's disease. A lot of cancers. We still.
I got a friend, he's 5 years younger than me, who's diagnosed with Parkinson's disease.
Yeah.
Let's wind this down.
Yeah.
If you were going to grade our current health care system, just broad stroke,
Yeah.
today, where are we sitting at? How would you grade it? Where we're sitting at right now?
I think I'm a little more optimistic than most people. I think I'll give it a 6 out of 10. And the reason I say that is because I experienced other healthcare systems. The bad things and the good things, right? Let's start by the bad things, and we'll finish with the good notes.
Let's do it.
So the bad things is it's very expensive,
Yeah.
very, very, very expensive and very inflated. That test you did that cost you, call it $350. If they bill insurance, is going to be in the thousands,
Yeah.
right? So it's inflated. It is it's insurance controlled. That's one. Two, autonomy. Doctors are losing it by the day. They don't have control over what they prescribe. They don't have control over their clinical judgment. Example, you come to me and you have high cholesterol, you're not tolerating. I know that statins are not going to be good for you. You're not going to tolerate it. You're not going to be a good candidate for it. But I need to lower your cholesterol for whatever reason. And I think you need Repatha, right? Your insurance is going to say, nope, he needs to try statins. He needs to fail statins. He needs to have documentation of that. Then we will approve him. Otherwise, you're going to be paying thousands of dollars a
You
month.
hear about this all the time.
Yeah. Pre-authorization. Pre-authorization is a headache to doctors, which basically undermines doctors' authority and doctors' ability to prescribe medications and procedures and testing. And thankfully, I don't have to deal with that with my current model. But when you have seen the patient, examined the patient, and think that this patient needs this test, and you order it, and the insurance calls you and says you need a pre-authorization, you speak to a retired physician that has not seen a patient in 20 years, who's getting possibly a commission on every denial he's giving you, to explain to him why it is necessary to do this test, not the test he's talking about. And he wants the test that he's talking about for one sole reason, because it's cheaper.
Yeah.
So insurance driven, expensive, and one more thing, and I'm not sure if you saw this coming or not, which is we are practicing CYA, right? We are such a country being run by courts and, and lawsuits, and a lot of the medical decisions. I'm talking about 100, like close to 100% of your medical decision in the back of your mind. Am I going to get sued? Am I going to get in trouble? Right? You have some healthcare systems that got around this, where if you work through that healthcare system, you are protected. You actually are not going to get sued. If anybody's going to get sued, it's going to be the state, right? Not you. So you're protected. You're not going to be named on suits, and that gives a lot of peace of mind. But it comes with a price. So the fact that we spend so much on testing that is unnecessary, just because we are pursuing a phrase, and that phrase is "what if." What if I miss this? What if I did this? But what is your clinical judgment? What if this person is your dad? What would you do? Right? And the answer, if this was my dad, I would, not me personally, but the answer would be different for my dad, because I know what is right. I know what is the right answer. I know what is the right test. If this was a board question, I know what the answer is. But in the reality world, you're going to order everything under the sun just because you don't want to be blamed one day.
So I had a friend of mine on the podcast. He and I are both in construction. And we talked about how construction evolved over when we were kids to what it is now. And how we spend so much time and energy in construction with what you just talked about. Documentation, contracts, making sure that you cover every loophole for how something might play out. And we talked about how much more productive we could be if there was a different system and you and I could just agree that we're going to work together on this thing, and we don't need all of that. You know what I mean? If we could just, I don't think we'll ever get there. I think, especially with AI, you know what I mean? Where the AI can like determine every little outcome. I think the contracts get bigger and the CYA gets worse.
Yeah.
But if we could get back there and focus on you being a doctor without all the documentation, just say, hey, Keith, trust me. I got you. I'm going to do the best I can. And just kind of go back to that humanity other than all that other stuff you spoke to.
Yeah.
You don't see that happening.
Hard.
Yeah. We've already crossed
Lawyers run the show, you know.
Yeah.
And they protect us, but they run the show. But we got to give it to the system a little bit. The system is very accessible.
This is the positive note.
That's a positive note. The system has a lot of checks. You have to be a doctor. You have to go through so much, and you have to pass through so many checks, evaluations, regulations. It is very well regulated. Could be a little bit too much regulated. And it's accessible. You will never go to the emergency room and not get seen. I've seen other healthcare systems where you go to the emergency room and you have to pay up front. You will never need an emergency surgery, and that will be denied to you just because you don't have the money. If you need an MRI, you're not going to be waiting 4 or 5 months to get an MRI. You will not, in other healthcare systems, a lot of people are going to die waiting for their turn to be seen or in turn for them to get a test. So the accessibility, the expense comes with accessibility. So I would give it that positive thing. I think the future, especially with the pressure right now mounting, people are waking up to it. People are pressuring. A lot of people are dumping their insurances. I think the government is trying to put some pressure on the insurance companies. And I think there's a lot of positive changes. I think the insurance is great. I think insurance is a great concept.
But it shouldn't be driving healthcare.
It should not be driving
The doctor
healthcare.
should be making the call. And the
Absolutely.
insurance should
Absolutely.
supplement your decision.
Yeah.
And figure out how to
100%.
make it happen.
100%. So we have the backbone. I think we just need to take a step back and look at things without the financial aspects of it, right? So as an insurance company, you're in there for money and business, right?
Understood.
But at the end of the day, it all comes down to treating people, making them healthier. I'll give you a good positive example. Some insurances, life insurances, are giving patients incentives to be healthy. If you go to the gym and you take a selfie at the gym, you get points. If you eat a healthy meal, you send me a selfie, you get a point. If you sign up in this service, you'll get points and you'll get like cheaper things. And people are going into life insurances more and more now, and they're getting incentivized by that. And I see where health insurances can do that, right? So you as a health insurance company, if you want to save money, you should not be saving it by denying payments. You should be saving it by preventing admissions to the hospital.
There you go.
Right. And I think I'm seeing a lot of that. So I cover the hospital for one big group here in town, and they're implementing it. So they get incentives from the insurance companies to keep people out of the hospital, to encourage home visits, to encourage primary care visits, to do a lot of things outside the hospital. So I think the next step is adding some sort of food education, exercise education to the younger population, where we can prevent when right now we are trying to save money next month, right? By preventing this person with heart failure from being admitted to the hospital over the next month or two. But the same concept, if we apply it to prevent Keith from going to the hospital when he's 70, 20 years ahead of time, I think this is when we're going to see success.
Understood.
Yeah.
You just unlocked a whole nother podcast that I want to have you on about.
Yeah.
Maybe in 6 months or so, you just
Yeah.
unlock something else. But for now, you gave me enough to digest on. Again, thank you for being here. I'm proud to call you. I will call you my friend.
Yeah,
And,
that's my pleasure.
I've developed a relationship with you, and I feel like we're kind of cut from the same cloth and the same mindset when it comes to health. You've helped me a lot. I feel confident with where I'm at now. I know where I'm going. I just needed that right person. I need that right person face to face just to develop a relationship with and point me in the right direction. Can't replace people in relationships.
You can't.
You and I have developed a relationship.
Absolutely.
I think at the end of the day, life's about relationships.
Absolutely.
So-
Absolutely. Well, I appreciate you having me here. It's been a pleasure. You have a beautiful place. And you have the right thing going on here, and it's a pleasure taking care of you, but also it's a pleasure, yeah, being your
That's a
friend.
win.
Yeah,
That's
let's get out of here.
okay. Still strong. Watch me rise my way. Slow growth turns into real change. I found joy in the simple days.